Most babies can have some digestive issues from birth and it's really common, but it can be really daunting. Don't worry, that's what I'm here for. Hi, my name's Emma. I am a registered midwife and I'm also a mum. In today's video, we're going to be talking about some of these common digestive problems that you might experience with your baby. A baby's digestive system is really underdeveloped at birth, and then it quickly evolves as they get older over the next 6 months of their life. And this is why it's really common to experience some digestive problems like colic or reflux or constipation because of how rapidly their digestive system is changing. In the UK, statistics show that roughly 40% of babies will experience reflux in the first 3 months of their life, whereas 20% of babies will experience colic. So first, let's talk about reflux. Reflux is where your baby's stomach contents flow backwards, or you might know it as spit up as well. It's really common in the first 6 months of life, but then as they get older, these symptoms should decrease. Some signs of reflux can include spitting up, vomiting, and your baby just being a little bit irritable in general, either during or after feeds. Things that can really help for reflux include making sure your baby's upright when you're feeding them and taking lots of breaks in between for things like burping, making sure you're getting all that excess air up during a feed. It's also really important to choose the right teat size for your bottle when you're feeding your baby. Again, this is going to make sure that the flow of the milk is correct for your baby and that they're not experiencing any of that excess air. It is quite common for babies to experience reflux or spit up, but if you're a bit concerned that it's a little bit more than usual, be sure to contact either your midwife, GP or health visitor. Now we're going to talk about constipation. This is characterised by infrequent bowel movements, so your baby pooing less, and you might find that their poos are maybe pebble shaped, and you might find that they're straining a lot when they're going for a poo as well. Constipation can be diet related. It might be that baby is a bit dehydrated, and it's really common to see it when you start weaning and introducing solid food into baby's diet. Things that can help with constipation are things like really gentle baby massage, so rubbing their tummy, and then also leg cycling. So you're just going to grab their legs really gently and move them about like this. That can be really helpful. Colic can often start when a baby is a few weeks old, and it can be really hard as a parent because sometimes it feels like your baby never stops crying. There's no exact cause of why colic happens, but some of the symptoms are your baby being in discomfort or baby being really fussy before, during and after a feed. One thing we do know can help colic is soothing techniques like gently rocking your baby or swaddling your baby. A change in their feeding routine might really help as well. It might be even worth looking into a different formula, but definitely always check with your GP or healthcare professional before doing this. Now let's talk about baby poo. This can be so different for every baby depending on whether they're breastfed, bottle fed, and how old they are. Baby's poo can change in texture, colour and frequency as they get older or as their diet evolves. Breastfed baby poos tend to be yellow, whereas a bottle-fed baby poo might be more yellow-green or even a pale brown. Once your baby starts eating more solid food, their poo's more likely to change texture, and it's also going to be more of a darker brown colour. Green baby poo might look strange, but it's actually really common and nothing to worry about at all. Keep an eye out for any unusual changes in your baby's poo. Sometimes you might find that your baby has very dark stools or that they're very pale or white. However, if this is really persistent or you're worried about anything, definitely get in contact with your GP, your midwife or your health visitor just to make sure if this is normal for your baby. Always make sure you're making informed decisions and make sure you're prioritising your baby's health and happiness. Keep going, you're doing such a good job.